Good evening, Voice of Canada. We are once again, it's a pleasure for us to be here this evening with a brand new show. And today we have a very, very dynamic guest, a powerful guest, who is the deputy leader of opposition and belonging to our party, second party, NDP. It's really an honor for us because usually 90% we had all the VIPs and the government dignitaries from the ruling party, but we are proud to have an NDP. Number 2 to Adria Horvat. Am I right?
That is correct, yes.
Welcome to our show, Doctor. You're a doctor too, so it's an honor. So we'll address you as Dr. MPP.
Oh, thank you so much.
Okay.
It's an honor
Sara,
to be here
welcome to
today.
our show, Voice of Canada. It's an honor, pleasure to have you. Believe me, and I would like you to formally introduce yourself to our valued audience.
Oh, thank you so much, both of you, for having me on today, and thank you to everyone who's tuning in. As was mentioned, my name is Sara Singh, and I'm your member of provincial parliament in the riding of Brampton Center, and I do also serve as a deputy leader of Ontario's New Democratic Party and your official opposition here in Ontario.
Hi, Sarah. How are you doing?
I'm doing very well.
So we'll start with the interview right now.
Okay, fantastic.
Welcome to our weekly talk show that is Voice of Canada. So my first question for you is, kindly inform our viewers what are your basic duties at Queen's Park being the MPP, and how do you represent your constituents?
Thank you so much for the question. You know, as a member in Brampton Center, I represent a very diverse community, and the needs are extensive. And so a big part of my responsibilities are about connecting with our constituents, listening to their concerns, and advocating on their behalf. So, you know, on a regular basis, I have meetings with people in our community. We talk about issues like the hospital, for example, and the fact that Brampton only still has one hospital.
We are about to talk about the hospital,
about
especially
700,000
in
people.
the Peel.
Absolutely. And for Peel, you know, I think in Brampton, when I speak with my community members, this is a major concern for them. But it's also things like affordability that they're very worried about. And so my job is to raise those issues on their behalf. And as New Democrats, you know, we have proposed in the House motions and bills to help address some of these issues. And I know we'll talk a lot about that. But a big part of my responsibility is listening to our community and voicing their concerns and putting forward actions that'll help make life better for Ontarians.
I will continue Mitali's question to you. Okay, I was reading your bio. You're also a critic at Queen's Park for long-term care. And you saw what happened during the pandemic, recent pandemic. The long-term care really failed, practically failed.
It did.
So many issues came up. Otherwise, nobody knew what are the issues in long-term care and how they were neglected. So would you like to throw some light what NDP is doing for long-term care, improvement of long-term care?
Absolutely. And I think, you know, as you highlight, you know, we saw during the pandemic, our long-term care system really fail a lot of our seniors.
It surfaced, all the issues surfaced.
It did. And much of these issues that we saw in long-term care were actually created by the previous Liberal administration because they did not make the investments that were needed. You know, we had SARS, the commission that was put out, and there were several recommendations that were made to help us prepare for another pandemic.
But nobody took any notice of it.
But they didn't take that seriously.
They took it for granted.
They did take it for granted. And, you know, as New Democrats, we had many of my colleagues, for example, you know, I think of Teresa Armstrong, who was the previous critic. She's been fighting for 4 hours of hands-on direct care, even before the pandemic, because we knew that seniors in our long-term care homes and elders, it's not just seniors that live there, it's also people with disabilities that call long-term care home. That those investments were not there. They were not getting the staff resources. They were not getting the hands-on care that they needed. And so that's why the NDP, we've been fighting with the government to make these investments to help shore up long-term care, pay workers fairly so that they get the wages that they deserve. It's not easy work.
And remove all the defects in long-term care.
Absolutely.
We lost lots of precious life
We
during
did almost
COVID-19.
nearly over 4,000 deaths happened in long-term care.
Terrible.
It's absolutely terrible. And one of the things I want to point out that's very important for the viewers is that in Ontario, we actually have the highest percentage of for-profit long-term care homes. That means it's private
Privately owned,
corporations that are running these long-term
They
care
are
homes.
minting money, but not putting any efforts or
Into putting it
investments.
into care. And so we saw during the pandemic that the homes that were not-for-profit or municipally operated, they had lower death rates, better life outcomes for the residents compared to the for-profit homes. So one of the big push is from the NDP is that we get profit out of care and that we stop providing corporations with billions of dollars of taxpayers' money for them to reward their shareholders and not take care of
the seniors and the people who are paying.
Absolutely. We believe that every public dollar should be reinvested into care, not into the profits of long-term care corporations.
Yeah.
Thank you.
Thank you. So as you are aware that soon your first term will be ending in June 2022, right?
Yes.
So how satisfied are you with that you did your best for your constituents and all the residents of Brampton Center? And what will you be doing if, God willing, elected again to the office for your second term?
We are very sure we'll soon after you win, we'll bring you again in this chair and congratulate you.
Well, I believe a lot in God, so lots is in God's hands. But, I think over the last 4 years, we have done a lot of work, and I hope that work resonates with our local community. We have fought at every opportunity we've had for another hospital for Brampton and for Brampton to get the healthcare investments that it needs. And I'm very proud of that work. And most recently, I tabled a motion to help fund a cancer care center for our community. And, that was received bipartisan support. So, I'm proud of the legacy that I'll be leaving if I don't get elected. But I'm really hoping that I will get elected so that I can continue this fight, because we know it's not over. Brampton hasn't still received its fair share. We are still paying, for example, some of the highest auto insurance rates. Housing prices are skyrocketing in our community.
We are coming on all these issues.
But these are all
I'm going to bring up all those issues one by one.
Absolutely. But we need to keep fighting. And what we need is strong leadership that isn't going to be silent on those issues. And that's something that when I get reelected, I'm looking forward to keeping up the fight for the city that I was born and raised in.
Definitely.
Yeah.
Dr. Sara Singh, it's a pleasure to call you a doctor and MPP.
Thank you so much.
And
it's
the
an honor.
Deputy Opposition Leader. See, you have got a very long designation than your name even. So just inform our valued viewers, what are the demographics of Brampton Center, where your riding starts and where it ends, for the knowledge of the people?
Absolutely. Well, Brampton Center is a very diverse riding, and we encompass sort of the middle of Brampton. So the riding starts at Hurontario. It's a very strange cutout. So it starts at Hurontario and goes all the way to the border of Torbram. But in some parts of it, sort of in the more northern part, it only goes up to Williams Parkway or to Beauvais. So I encourage people, just go onto the internet, search in Brampton Center, and you'll be able
because
to
they
see
should know. Just now the elections are also going to coming, so people should know what are the riding limits.
Absolutely. So it's a very large riding right in the middle. It encompasses beautiful parks like, Chinguacousy Park, for example.
Chinguacousy comes in your riding.
Comes in the riding. Also includes our Lakelands community over at Beauvais and Hurontario near the Fort 10, but goes all the way down to County Court, so onto the border of Mississauga. So it's a very large riding. So that's why I encourage people, rather than me try to explain it, go onto Google, you'll see all the borders, but do find out which ridings you live in, because every vote counts, and we want you to get out there and support in Brampton.
And what would be the population of your riding?
So we're just
approximately.
We're just over 100,000 people.
100,000. Then it's a big riding.
It is
fairly a big
yes,
riding.
Yes, yeah. Brampton is a huge city. That's why in the last election we had an additional 5 ridings come in. Right, we grew from 3 to 5.
5, yeah.
And so the city is growing, and that's again why we need to keep advocating for the services to grow with this. It's great to have more members of provincial parliament, but we need to make sure that we get more services for our community. Dental care, vision care are so important for people's health and well-being. Federally, we just were able to strike a deal with the Liberals to help provide things like dental care to people across Canada. And as a provincial government, that's something we've committed to delivering on and working with the federal partners to make sure that we have the structures and policies in place to provide dental care. That's a step in the right direction, because as we said in 2018, there are many people who don't have dental coverage. And so that means they aren't going to the dentist, they aren't taking taking care of their oral health. But oral health is a part of our health. And so for many people, if they don't treat, for example, a cavity, this could end up in a visit to the ER because of the pain or an infection. So if we're able to get people the dental care they need, we actually can save the system money down the road. Same thing with vision care. We hear from so many people in our community who, don't go and get their prescription.
It's too costly.
It's too costly for them. They don't even want to get a routine exam because it's very costly. We know that in Ontario, our optometrists, for example, were, protesting because the government has not been able to strike a deal with them and not paying them properly. So, under our plan, we have committed to making sure that our optometrists are paid fairly, but also that people in our communities can access those services. And when it comes to the minimum wage, absolutely, that's something we were campaigning on in the 2018 election. And unfortunately, when this conservative government came into power in 2018, they actually froze the minimum wage increase that was supposed to take place.
That was announced by the Liberals.
It was announced by the Liberals.
But it couldn't take place.
And they stopped it. And now we see them just before the election making all these big promises.
That has got no value. The reason is that the inflation is so high.
Absolutely.
That the people are unable to beat the inflation.
No, and this is part of the challenge that we need to make sure people understand. Your wages could have been increased 4 years ago, right?
Yeah.
Which would have helped. That's thousands of dollars that would have gone into Ontarians' pockets that the government is now playing catch up to try to make up for what they did. And it's not enough, like you said, right? In many communities, we know that $15 is not enough to pay rent. Recently I read a report and it indicated that if you were a minimum wage income, so 2 individuals working minimum wage
you cannot afford even food on the table.
And it would actually take you, for example, if you wanted to purchase a home, 51 years to save for a down payment. It's out of question.
Housing, so we are about to talk, because housing is a very, very big issue. It's going to be very explosive issue.
Absolutely.
People will come on the roads. The situation has come up to that level.
It's happening already. And that's why we said that a minimum wage needs to be increased, but it needs to be done in a way that is predictable and over time. So we have a plan to get us to a $20 minimum wage, but over years. So the businesses, our small businesses in particular, are not shocked immediately. What the government, absolutely. I come from a small business family. Absolutely. I come from a small business family. So I understand, right? You need something that is predictable.
Slowly and steadily.
That's our plan, is slowly and steadily, right? Increasing that wage and helping those businesses prepare. But currently, that's not what we're seeing. We're seeing, overnight the government is making these promises, well, we're going to raise it, we're going to raise it. That doesn't give those businesses the time to prepare and absorb those costs into their operating costs as well. So, that's why I think it's so important for people to understand. For the NDP, we have very fiscally responsible policies to help us build an economy, but do it in a way that doesn't hurt people and everyday.
Do we have resources? Where the NDP will get the resources to bring all those additional facilities?
Well, there is a fully costed platform that we had in 2018.
The feasibility is there.
It is. Absolutely. It is. And you know what? I think when we look at the investments that are needed, as we discussed, whether that's in long-term care, health care, vision care, dental care, these are all investments that people believe their tax dollars should be going towards, not doing things like wasting it on, contracts that are getting canceled, as the Conservative government has done, $30 million in some examples, right? People want to know that their tax dollars are being spent wisely, that they're being invested in the services they're going to depend on. And so I do believe that we have a plan that will help us make those investments and get our economy back on track.
Dr. Sara, as I'm continuing, we are talking about the health policies only. So there are 2-3 things are there to be discussed prior to we move forward. The emergencies, they have practically failed the people.
Yeah.
The wait here in Mississauga and Brampton even is ours. When a person goes in pain, when a person goes in difficulties, the person is, I've seen patients on the floor, lying on the floor. We can't see those things happening in Canada. Canada is a developed nation, a civilized nation. We don't belong to a third world country. How the human beings and the citizens are being treated. They are not being treated well, and they come home in pain and they suffer till the next day they see their family doctor.
It's a big problem for us. And as I said earlier, in communities like Brampton, we have never received our fair share of provincial healthcare investments. In fact, we received some of the lowest rates per capita in the province in Ontario, in Brampton. So that is very troubling because, as you point out and illustrate, far too many people are waiting in the hallways for health care.
Always.
And they aren't getting the care that they deserve. Born at the old Peel Memorial Hospital in Brampton.
Wow.
And so, when that was torn down, everyone in our community thought we were going to get a new hospital that would serve the growing city.
So basically you are a Canadian.
I am.
You're born in Canada.
I was born in Canada, born in Brampton.
Can be anything, but you are a Canadian.
I am, absolutely. And you know what? My parents, they come from diverse backgrounds. My dad's from Punjab, India. My mom's from Guyana. So, it's beautiful that this is what Canada is. We're a mosaic of all these different cultures. And so I'm really
Both
proud
are
of that.
beautiful cultures.
Yes, they are very beautiful.
Guyana
East and West and, here in the North. So
looks are Guyanese, but your accent and everything is Punjabi.
Well, thank you. Thank you so much for that. But, when it comes back to the healthcare issue, growing up in the city, I saw that we weren't getting our healthcare services the rate we deserved. I would go to the hospital with a family member, my grandmother, for example, and we would wait for hours in the hallway, right? And even subsequently since then, over the years, almost every time we've needed to visit the hallway, we're waiting 6-8 hours just to get into it, right? And
anybody
another
looking after
6 to 8 hours just to get
one
care.
doctor in emergency
And
is
so
totally inhuman.
It's not acceptable,
At
right?
times there are 50-60 people in emergency.
Absolutely.
And 1 or 2 doctors is not going to solve the problem.
It's not enough. And so, it's very important to acknowledge that even when Brampton Civic opened in 2017, we were at capacity the day those doors opened. And routinely, we're operating at 500% or more over capacity because the healthcare resources are not there. So it's not just about a physical infrastructure that we need. We need the healthcare staffing resources in those hospitals. That means more doctors, more nurses, so that people can actually get the care that they need in a timely manner as well.
But another question connecting with same question is that since long, people are really fed up of paying such high charges for parking.
Yes.
If you park your car in Mississauga hospitals per day, it charges $30.
$32 actually.
$32.
Yes.
Okay, that's good you corrected me. So it's unreasonable.
It is absolutely not fair.
People are in hardships. People are hard of cash. People are in worries. They have got other expenses to meet. Their near and dear ones are already in hospital.
Yeah.
So please bring in this question that this is not a resort or a 5-star hotel. Minimum charges for parking should be charged for maintenance.
Absolutely. It is something the NDP has advocated for because we understand,
it's a long outstanding
problem. It's kind
problem.
of taking advantage from the people, right?
It is in a way, right? And I think that, as you said, someone is coming to the hospital because a loved one is sick or they're ill themselves. To have to pay $32 just to park there, it's not fair to people. Right?
Poor people, what they do, I've seen with my own eyes, experience, because I'm an activist. So I've seen people dropping their sick people outside the hospital and running into other plazas opposite.
And that creates a very, very unsafe situation for them because now their car might get towed.
It doesn't look good for Canadians.
It doesn't, no.
So we'll be soon going on a short break and we'll be back with Dr. Sara Singh. Once again, the interview is a really interesting one and would really love to talk in our prescribed time. So see you soon. Thank you.
Welcome back after our short break to our popular show, Voice of Canada, hosted by Asphandiar Wadiwalla and co-hosted by myself,
Mitali Panda.
Mitali Panda. My name is Mitali Panda. Yeah. So Dr. Sara Singh, inform our viewers, are you a medical doctor or a PhD
it's
doctor?
A nice humorous question.
It is. No, and thank you. I get asked quite a lot, actually. I am a PhD, and so I completed my doctorate degree last year from X University in policy studies. But the question actually makes me think very much of my grandmother, my late grandmother, who always asked, what kind of doctor are you going to be? And she would always ask me, medical questions, and I'd say, BBD, I'm going not going to be a medical doctor. I'm going to be a PhD.
No.
So it's a question we often do get asked. But, I have an academic background. I was a teaching assistant before I got elected. And I actually worked very closely with Stephen Lewis. And so that's one of the reasons that I got inspired to get into politics. Yes.
To serve the communities
to
more.
serve our communities. And, inspire young people to also take up space politically as well.
Once you're already finishing your first term, God willing, you'll be coming back. What are the projects of development which are still remaining, or what you plan to do in the next 4 years?
Well, thank you so much for the question. I know we are laser focused right now on our re-election so that we can do some great work for the people of Brampton. I know that even though we have fought over the last 4 years for Brampton to get a third hospital, that is still something that has not been committed to by the government. And so that is work that I will continue to do and hold the government accountable to make sure that Brampton gets the third hospital that it deserves. Additionally, I know that, as I said earlier, the cost of housing is going up. And so working with the government to make sure that we invest in housing for people so that they have the housing that they need. It's a human right after all, right? And then the other big issue for us in Brampton is lower auto insurance rates. Honestly, when I'm out door knocking, it is the number one issue for people.
Everybody is feeling a pinch. But the question is here, I would be very, very clear to our public. We don't want to keep them in dark. The auto insurance high is due to Brampton only. So, you're aware of the fact, lots of TAPs, lots of policies and demands and claims are coming from Brampton, due to which whole Ontario suffers.
Well, I don't know if that's necessarily the case.
You can ask the figures from the police. Our police will give you the figures.
Certainly, but I would say that also your driving record should determine your insurance rate, not what your neighbor's driving record is.
Individuals as
well.
Record.
And so, when I speak to people in Brampton, in my community, they aren't driving luxury vehicles, right? They're driving regular cars like Toyotas and Chevrolets, and they are paying more than what someone, for example, in a very wealthy community of Bridle Path, for example, would be paying on their Maserati. That's just not fair to the people of Brampton, right? There should be
Brampton is a rich city. I've seen a lot of posh cars.
There definitely are posh cars, and those folks should pay their fair share in auto insurance. But, working class people shouldn't be penalized because of where they live. When we look at how the rates are calculated, if someone moves simply just the same driver moves to Caledon, their rates are going to drop by almost half.
Or if they go to Montreal.
Or if they go to Montreal,
pay $50.
they pay less. And so because they have different systems in place, right? So I think when it comes to the auto insurance issue, we need to be fair for drivers, and we need to do that across the GTA and the province so that one community isn't paying more than others are. If the risk is the same, it's not as though the risk's different if you just go across the border to Mississauga. The same amount of thefts and issues are there. It's a growing city as well. It's still under the Peel Regional Services as well. So I think it's not fair to say that only Brampton is at blame here. I think the way that the rates are calculated is the issue. Rates should be calculated based on your driving record, not your postal code.
Dr. Sara Singh, as you're already in the election mode also, for the forthcoming election, the rate is about to fall. Tell our viewers what additional activities you are doing for door knocking, meeting your constituents, plus handling your great responsibilities as the leader of the House opposition, at the same time your MPP duties and other things. How you manage so well?
Well, I have a fantastic team that helps me keep track of everything. And, it's a very busy time for us right now as we head into an election.
And we appreciate you came in this busy, hectic time also.
It's my pleasure to be here. So I appreciate you making time. But, lots of activities are happening. We are kicking off our campaigns. We are door knocking almost on a nightly basis, connecting with residents. COVID has made it hard that we weren't able to kind of go out and meet people as much as we might have wanted to. So we're definitely getting out, connecting with our residents. We have a really great positive momentum here in Brampton Center and just looking on ways to build on that. But as we wrap up our legislative session as well, just a week left to go, I'm very excited by the work we've done. We've continued to fight for Brampton's healthcare, continue to fight for affordability, and we'll continue that work as we head into the election to help people understand, the policies of the NDP and the great work that we're committed to doing for them before and after the election.
Nice.
So, viewers, due to paucity of time, as we are running late today, because we had lots of other issues today, but we did this show. But we promise you that soon after the provincial elections, we'll bring Dr.
again.
Sara Singh once again. She's a wonderful speaker who has given a wonderful information. So many questions are left which we couldn't ask her, but we'll keep pending as Sara Singh Part 2. Thank you, Sara, for coming into our show, Voice of Canada. It was great honor, pleasure for us that you are here with us. Keep in touch with us and keep us informed so we can always inform our viewers what the issues are or what all is happening at the Queen's Park.
Thank you.
So play a positive role. Thank you and good night. We'll be back next week with our new guest. See you. Goodbye. Ciao.
Good night, everyone. Take care.